Hello and welcome to the series premiere of Vet's Eye View. My name is Victoria Knight and I'm at the Center for Animal Health. We have many patients today that we are going to be encountering. We're going to dive deep into detail about exactly what's going on with them. So let's head inside and meet Dr. David Visser and go into detail. But before I do that, make sure that you do like and follow our page, and let's head inside.
There you go. Nice to see you. Yes. How are you? We humans are intrigued by cameras too. Sometimes yes, sometimes no.
So doctor, what
Yes.
is it that we are going to be doing at this moment right now?
So Sadie is here because she had urinary issues, and what they noticed at home was that she was having accidents. She was needing to go outside more frequently. And that, of course, is a problem, not only for the person who wants to get sleep, but the pet who's experiencing a urinary problem. So when they can't hold their urine, they're going to complain and want to go outside more. But what was also unique is that they noticed blood in the urine at home. And so when coming in for an examination, we wanted to make sure that we know whether a urinary infection is present or some other condition that causes this. And so the first step we do is an examination, but we also check a urine sample to see whether there's any evidence of infection there. And on this particular sample, we were able to find that there's a lot of white blood cells, where there normally wouldn't be any cells at all. And white blood cells fight off infections, so we know that there is a urinary infection there. She had a situation similar about a month ago, but came back because of these signs. And so we think that maybe it didn't get completely taken care of. That happens sometimes, but we're going to go with medication to get it under control again this time. How are you this morning?
Good.
I'm Dr. David Visser, of course. Good to see you. How are you today?
Good, how are you?
Excellent. So I heard about the skin issues, and it's been going on a couple months, and you've not noticed any itchiness associated with it.
No, she
Okay.
doesn't ever itch, really. It just falls out.
Okay. Hi there, honey bun. And then she's also been acting kind of stiff and not getting up and around. Are these happening for the same time periods? Like, did you notice it about?
Usually, the hair loss started first.
Okay.
And then, like, the stiffness and the runny nose and the, like, laziness, coldness started all about around the same time.
Okay. So I like the good news that we've got on the examination, but of course the skin condition is telling us there's more going on than meets the eye. So we have something to look into. My suggestion as the first step, of course we're going to be doing the heartworm test, but on that blood sample I think it would be advisable to check to see how internal health is. We're lucky in that our heartworm test does automatically tell us about internal organ functions. But one of the things that will be important to consider as well, especially with the joint issues, Lyme disease, have you heard of that?
Yeah.
It's getting more common, and we're not always knowing that a tick happened, but ticks transmit this disease, and Lyme disease kind of stays dormant for sometimes months at a time before it starts causing signs and symptoms. And the stiffness that you described is the thing that rings a bell for me.
Yeah.
So it's important to know whether Lyme disease is there, and we'll test for that, and we'll have those results probably within 15-20 minutes.
I'll snap it down, and then it checks for antibodies, and it'll show up a positive on the test here.
So this dog was diagnosed with Lyme disease today, the one that was having some achiness and difficulty getting around. It's not likely that the skin condition is actually playing a role in that also, but we're going to go with the diagnosis we have until we have other diagnoses. Lyme disease is transmitted by ticks, and so when dogs get exposed to that over the course of months, that disease kind of insidiously gets to the rest of the body, and it can cause joint issues, interference with appetite, and it can mess up other aspects of metabolism. So it could all be interrelated, but we're going to treat for that. We're awaiting other tests, and if the antibiotic, which takes care of this Lyme bacteria, clears it, then we might be in the clear with all of these health issues, so the prognosis could be good.
So when a dog is diagnosed with Lyme disease, what is the survival rate in that sense?
We're actually pretty successful in managing Lyme disease. In people, there is often a chronic condition that they have difficulty getting rid of it. So that doesn't happen as much with pets. When we diagnose this in dogs, who are most commonly affected, we begin a treatment which is a 1-month course of an antibiotic called doxycycline, and that generally takes care of it. The tricky part is that there's a test that can diagnose it, but I don't have a test that will tell us that it is completely cleared. The test that was done to diagnose it will still be positive after that treatment is done. So we go for the 1 month and we look for the improvement in the signs, and if there's no recurrence of signs, we assume that we have crossed the finish line with it. I'm going to start at the toes and work my way up, just to make sure I know whether there's anything further down. I will say that the knee is the most common area for dogs to have issues. There are several bones in the ankle. I'm not feeling any abnormalities or swellings there. There are 2 bones in the lower legs. We're just checking to see if there's any pain along there, and then checking the extensor muscles and the flexor muscles. No abnormalities so far. I did hear a click and feel a click right there in the knee, and I'm just going to feel for any abnormal movement in the knee. I think you can see that I'm moving this knee in a direction that's getting some sliding motion here. You see that? Yeah. So this sliding motion is called drawer movement. Just like pulling out a drawer, it slides, and it shouldn't slide. There are 2 ligaments in the knee that cross over each other just like this, and they are called cruciate ligaments, and cruciate ligaments means cross. These 2 cross over each other. This one right here that is my right finger is the equivalent of the anterior cruciate ligament, and its job is to prevent this sliding motion that I'm able to get here in this knee. So that tells me that that ligament is torn. Have you heard of an ACL rupture in a person? Yeah. That's what this is. Now we have ACL anatomy just like they do. They have the same kinds of issues, and that is probably then what happened, is that she fell and then put strain on that ligament. And you may wonder, isn't this something we diagnose on x-rays? X-rays don't tell us about ligaments because they don't even show up on x-rays. Ligaments, ligament damage like this, is the diagnosis is made by feeling something move that shouldn't move.
So with Sheba, where do we go from here on treatment?
Well, this is going to be a difficult thing for the families to face, but a mechanical issue calls for a mechanical treatment. And so since this occurred mechanically, we have to treat it through surgery. And so a lot of times you would think that if the ligament is torn, why don't we just stitch that together? But the ligaments don't actually hold stitches, and so there's no way to actually treat it by just stitching that together. If we know that the ligament is preventing a certain type of physics movement within the knee, we need to put something in the knee surgically that prevents that same physics from happening while still allowing the knee to go through its normal flexion and extension. Okay. So we install a surgical non-absorbable suture material that holds the knee in the same sort of manner that ligament formerly functioned, but we do it in a different location. So the ligament lives inside the knee, but treatments that are inside the knee are actually rejected like crazy. So we have to do it outside the knee joint, but still under the skin. So it provides that stability, allows normal range of motion. It's a surgery that is fairly common, an injury that is fairly common, I should say. And this type of treatment is one of 3 different treatments that are available. And pets come in for this operation. Operation takes about 45 minutes or so, and pets stay overnight for recuperation, go home the next day. It's a fairly stable type of repair, so they are able to have some reasonable amount of activity, but our goal is to return them to normal function afterward. How are you doing, huh? Nice to see you. I know, it looks kind of different, doesn't it?
Just a little nervous.
So what I typically do is evaluate for the appearance of the teeth. They always have this nice pearly white color, but if it's covered with something that doesn't belong there, that's what we see as the brown, sometimes green, sometimes black material. So that's tartar. And of course we look at the incisors, are the small ones up front, and the fang teeth are the sharp ones right there, and then premolars are the next ones back, and then molars all the way to the back. The 2 teeth that typically show the most tartar are the fang teeth, because they don't really get their tongue around to clean those, and the big upper back tooth. that tends to accumulate more tartar, not only because it's hard for the tongue to keep it clean, but the salivary gland is right above it, and so there's a lot of mineral in saliva. In any case, there is a lot of tartar that's there. The good news when I look at the mouth, though, is that I do not see a lot of gum damage, but I see enough that says if we don't get rid of the tartar, it's going to go there. So we should be talking about doing a teeth cleaning. And a teeth cleaning, of course, is removal of the tartar. Brushing and all home dental care like dog chews and things, that's removing plaque. And plaque, of course, is what turns into tartar. So the more that that's removed, the later it is that a tartar removal procedure is necessary.
So I saw Charlie was in today for some possible dental issues. Would you want to elaborate on that?
Sure. So dental disease is one of the most common things that affect pets. I mean, we vaccinate for diseases that they might not ever even see in their whole life, yet 80% of pets of any age have dental disease to one degree or another. I should say after 2 years of age, because it does take some time for tartar to build up and then have issues. And that's exactly what Charlie was having. There was a time that tartar had built up enough that it was noticeable. And some people don't notice on their own pets that there's some dental tartar or issues going on. That's why we need to pull the lip back, pull the lip up, and actually check the mouth on a regular basis. In Charlie's situation, the benefactor was the groomer, because the groomer identified during grooming that tartar and redness along the gums was identified. But if we don't notice it or have somebody else noticing it, we have to kind of figure out how we're going to make sure that we know what's going on in such a hidden area. So checking the teeth on a monthly basis is important, and when we find that the tartar has built up enough, then it's time to schedule a teeth cleaning. Now, plaque turns into tartar, and plaque is removable at home with brushing and dog chew treats and such, but the only teeth that are going to be getting the benefit of plaque removal is those that are affected by what you're using. So toothbrushing with pets at home, you can choose what surfaces of the teeth to go after. If it's about them brushing their own teeth with chew toys, well, it's only going to clean the teeth that they actually chew with. And so there's other teeth that go untreated in that regard. When it comes to tartar, that only can be removed by having a professional dental cleaning done. And just like us, although different from us, just like us, we need to have the tartar removed professionally. And at the dentist, we might go every 6 months to have that done. But with pets, when there is a certain enough accumulation, that's when we will recommend the teeth cleaning to be done. We hope to get there before it actually irritates the gums or threatens the support structures. And in Charlie's case, there's a lot of redness along the gums, but I don't think there's any threat to the support structures so far. That makes this a reversible condition if we treat it at this time, whereas it would be irreversible or lead to oral surgery if we didn't get in there in time.
So what would happen to an animal if they went untreated with the tartar buildup?
Well, tartar is a disease. I mean, dental disease is as significant as other conditions. We know that bacteria get access to the bloodstream through these irritated gums. So not only can it be painful and local infection, but the bacteria can actually threaten heart valves, can threaten kidneys and other internal organs. So this is not just a cosmetic situation of making the mouth look good or smell good. This is actually about entire body health. So if the dental disease were to progress, it can threaten the internal organs, but it is especially painful in the mouth. I mean, we've seen dogs that are just showing their optimism all the time, but you open the mouth and it's just, you see teeth that are very loose, the tartar that is significant, and gums that are very irritated. We want to do things before it gets to that point, because that's not a comfortable way to live forward.
Thank you for tuning in today on our series premiere of Vet's Eye View. If you have any questions, do leave them in the comments below and we'll be sure to answer them. And if you haven't already, follow our Facebook page and our YouTube channel. And tune in next time on Vet's Eye View.